Welcome to Just Relationships, the show that offers you concrete ways to make your relationships better. Whether it's your boss, your spouse, your children, or your friends, the quality of your relationships in life directly affects how you feel about yourself and the success you achieve. Your host, Dr. Duffy Spencer, a psychotherapist, telecoach, author, and seminar leader, will interview top experts to help you learn to manage this essential part of your life. And now, here's your host, Dr. Duffy Spencer.
Greetings to you. Well, we live in an age of anxiety, it is called. Many people have that generalized anxiety disorder, phobias, post-traumatic stress disorder, otherwise known as PTSD, and insomnia. We are a sleep-deprived nation as well. Oh boy, are we in trouble. And I am very pleased to introduce to you Dr. Robert London, who has written a book called Find Freedom Fast. Short-term therapy that works, a 3-step program. Welcome, Dr. London.
Oh, thanks. Thanks for having me on your show. I really appreciate it.
Oh, my pleasure, Dr. London. So where do you want to start, and how can we cure anxiety, phobias, PTSD, and insomnia in a short-term way with a 3-step program? I'm so intrigued.
Well, I think before we want to cure it, we want to treat it first, because not everybody is going to receive great benefits, and there are some people who need longer-term therapy, but there are far too many people who could benefit from short-term treatment strategies who don't, because it's essentially not practiced that much, even though it's talked about tremendously when we talk about the current popularity of cognitive behavior therapy. I wrote this book, Find Freedom Fast, just to show that there are problems that people have in anxiety and phobias and even post-traumatic stress disorder, the civilian kind. I'm not involved with the military, and insomnia. And these motivated people to overcome these issues and have a more fulfilling life can do better by focusing on the problem, not the whole existence of man or womankind.
Yes.
And oftentimes, unfortunately, in an awful lot of therapies, which may be wonderful and people may feel comfortable in it, the focus goes in many, many directions. I come from a family of surgeons. And when I chose psychiatry, my father had a great deal of wisdom. He did say, if you're going to go into psychiatry, learn something a little bit different that the other folks don't do. And this was 40 years ago. He said the hospitalizations are really long. Of course, today they're much too short. And the medications, sometimes they help, but they give awesome side effects. And he was talking about the heavy-duty meds. And I'm not against medication. And, see what you can do that resembles the most of medicine, which is someone presents a problem to you. If it's a sore shoulder or a sore back, you focus on that problem. There's a certain set of ways to treat high blood pressure or heart disease. And I attended programs after my residency training in psychiatry. After medical school, I trained at NYU Bellevue Medical Center. And after that, I went up to New York Presbyterian, Columbia Medical Center, and trained with a great mentor, Dr. Herbert Spiegel. And he was a forerunner of behavior modification, what we're calling cognitive therapy today. And he taught a lot of hypnosis, which is very similar, I must say, to mindfulness, which has become all popular around the world. But it's just another ceremony to get people to be able to shift gears and relax and focus on more pleasant thoughts and feel better.
Yes.
So basically, I developed a short-term psychotherapy unit at NYU Bellevue and ran it for about 20 years. And around the same time, I started writing newspaper columns for many medical magazines. The last 15 or 20 years, it's been for clinical psychiatry news. And I talked about my learning, philosophizing, and action method, LPA, which is my spin on cognitive behavior therapy, and how you can take an anxiety problem or a phobia or even a post-traumatic stress disorder issue and be able to circumscribe it and get someone better in a shorter period of time. A shorter period of time is not easily defined. in terms of is it 3 weeks, is it 3 months? It can go either way. However, it's
so
just
let me stop you for a moment, Dr. London.
Sure.
Your spin on the cognitive behavioral therapy, which is basically we're looking at changing someone's thoughts, changing their minds, therefore changing their emotions, therefore changing their behavior. And you have your own special spin on cognitive behavioral therapy called LPA, which stands for Learning, Philosophizing, and Action.
Absolutely.
Okay.
The reason I like it is because it's understandable. People don't understand, in general, cognitive behavior therapy. I mean, cognitive means thinking, and I just try to simplify it. You learn something about some issues. Sometimes what you learn from the nicest people around can be faulty. And a person has to unlearn that. So we try and see in a very brief manner how someone learns something that's faulty. Then we kind of philosophize about it and how it's affected much of their life or a good part of their life, and develop a program of action to get better. The most important thing, I think, in talk therapy is getting a new perspective on the old set of problems.
Right.
I mean, that's the aim, regardless of what kind of treatment you're using. The idea is someone comes to you seeing things a certain way. I never sit at the right place at Thanksgiving dinner and I'm unhappy. Well, I mean, don't ruin the 2 hours because you're in the wrong seat. And it's just getting a new perspective on how you can negotiate your life so you reach your potential and you're not tied up in knots, K-N-O-T-S, going on for days, for weeks, for months. And across the country today, there's a tremendous amount of anxiety through work, through social life, through the politics. And even in the work world, I know it used to finish a day's work, whether it's 6 hours or 8 hours or 10 hours, and you could leave and take a break. Well, you can't take such a break anymore because your manager, your boss, your colleague texts you about something at 8:30 at night.
Yes.
And now you're texting back. Usually someone might, for an urgent situation, make a phone call. But now the texting becomes integrated into work and socialization, and the brain is always cooking, and it builds anxiety. And that's just one aspect of anxiety. The fragility of certain jobs affects people. There's a genetic component to anxiety. And then there are people who are just phobic about certain things. And phobias can be treated both with talk therapy, and I've done that. And, of course, some people do better with medication. But you have to first find out what... I like to try the talk therapy first and stay away from pills as much as I can.
Well, as a psychiatrist, Dr. London, I'm very pleased to hear that, because my understanding is that most psychiatrists today are basically psychopharmacologists, and you explain your symptoms and they give you some sort of medication.
Yeah, you're absolutely right. It's sad in a way, because the psychiatric training after medical school is 4 years, and you would always hope that you could do something greater to help alter someone's perspective on issues than pure medication management. Some of the medication management is linked with someone else who's doing the talk therapy, but I'm not always sure that those two folks who are doing it are in contact with each other and know what's going on. And I'm also very aware, being in the field for so many years, that currently there's an awful lot of over-medication. And it's not done purposely, but, you know, the medications that were developed in the 50s and the 60s in all fields of medicine, whether it's infectious disease, cardiac disease, blood pressure issues, and mental health and psychiatry, they've saved lives. There's no question treating certain issues with bipolar disorder can help a person. The schizophrenia can really be helped. So we're not against it. But what the problem is there are many times where the medications are not working. So you give a medication and then you add another medication and maybe a third medication, but you forget to take off number one and number two that after 3 months hasn't worked. And it just seems to be a problem. And in my career, I've talked with thousands of people, literally thousands of people. And when you first start to see them, some are being medicated very well, and some are, there are too many that are over-medicated, and then of course, you've got the side effect profile.
So Dr.
But I'm
London,
not talking about the psychotic disorders. I'm talking about the kind of work that I like to do, giving someone a new perspective on the old set of problems.
So, Dr. London, would it be fair to say that those anxious people who have a genetic component to their anxiety are better using medicine?
Yeah, that happens to be a great question, and I don't think I can answer that because I'm not sure the data is in.
Yeah.
Most of the studies always seem to show that if you need medication, it's going to work better in conjunction with talk therapy. That's the ideal. And going back to your important point a few moments ago, the psychiatrists used to do both.
Right.
And then for a lot of reasons, and some of them economic, they abandon much of the psychiatric profession abandoned that for medication management, seeing someone every 15 or 20 minutes, and some people do half hour, but it's a quick turnover. And there are a lot of reasons for that, but the economic one is there because unfortunately in our society today, we don't have health care for everybody.
Right.
And what's important is if you need to make a living to pay your bills and keep your office open, and that's just the business aspect of any career, any job.
Yes.
And unfortunately, the insurance people don't always refund very well for just plain talk therapy, and they sort of push towards medication management.
So I want everyone to know that you're in luck because Dr. London will be back next week for part 2 of Find Freedom Fast. And so what I'm getting so far, Dr. London, is that the idea is to concentrate on one problem. Don't try to solve all of life's problems. Just focus on that. Harness the power of focusing. And so can we break it down, the 4 things that you were writing about: anxiety, phobia, PTSD, and insomnia? So, in other words, anxiety, generalized anxiety disorder, is when people are anxious at everything and they have lost the focus of, is it a healthy fear or anxiety? Is it unhealthy? And what is the difference between fear and anxiety? Would you say there is one?
They're linked. They're linked. The dictionary definitions make them different, but they're very, very closely connected. And you try to get someone to kind of focus on what is the most prominent thing that makes them anxious.
Right.
How did they learn to be anxious? How did they learn to be phobic? I can think of a gentleman many years ago who was totally anxiety-ridden and phobic about dogs. And we go back to my learning, philosophizing, and action. It influenced lots of parts of his life. And he would cross the street when he saw a dog. He would sweat. His heart would go faster. He would worry when he left for work that he's run into someone walking their dog. It was really tough. It was really tough for him.
Yeah.
We learned very quickly that he grew up with his mother and grandmother, and both his mother and grandmother did not like dogs. Well, that's okay. They didn't like dogs, and as far as I'm concerned, that's fine. But in him, it translated into something very different. His perception of their dislike for the dog turned into a lot of anxiety and a phobic response. So he went to his primary care doctor who knew this problem, and there was no pill. The primary care doctor didn't want to give him a pill. And firstly, there's no pill you can take when you see a dog. I mean, you see the guy. You learn what it's about. You philosophize, and it's about mom and grandma. What he learned, and it affected him negatively. You philosophize about how it's affected his life, and it has affected his life. And then you find a plan of action. The plan of action was very straightforward. Go out and buy yourself a good dog book with pictures, which he did. And together, we looked at those pictures, and those pictures made him very anxious. As we turned the pages over a couple of visits and talked about this whole issue. He became calm as could be, actually enjoyed looking at the pictures. That was not the cure, so to speak. Mm-hmm. The next one was getting into the real world, okay? Do you know anybody and trust someone entirely who has a dog? Yes, I do. I know them. I don't visit them, but I know them. Well, could you set up an arrangement with that person where 2 or 3 or even 4 times a week you would meet them and they would have their dog on a leash, always on a leash. And over a period of time, you could approach that dog. He needed to do this for a very important reason. I'll just break for a moment, because he was invited to visit a friend who he had gone to college with 10 years earlier. And he was thrilled about that until he found out the friend had a dog. So this became a real motivating factor to address this issue. Whether he would have addressed it or not if he hadn't had this invitation, I can't speak for that. But on the other hand, we had this scenario where someone he trusted was holding the dog on a leash, and he would slowly walk towards the dog. Trust is the big word here.
Oh, yes.
Because never, never, never does the person holding the dog walk towards him. Mm-hmm. He has to be the master of this, walks towards the dog, and eventually the aim is to try and pat the dog. And most dogs, as you know, are jolly. They look like they're smiling. They want to lick you. They jump on you sometimes. Over a period of about 2.5, 3 weeks, he was quite successful. And everything worked for him. He visited his friend. I don't know if he ever went and got a dog. He was offered, if he needed to come in for more, he was more than welcome to come back for future visits to discuss whatever it was. And I basically never heard from him again. So there's an example of that was the problem. Even though it affected his life, what was avoided here was a year, 2 years, 5 years of talking about his mother and his grandmother.
Right.
And whether we talked about them positively or negatively, that was not going to help him. And, how could they have done this to him? Didn't they know that his young mind at age 5 or 7 or 9 would perceive it, And that kind of stuff may be very helpful. However, it doesn't get the problem solved.
Right.
And it tends to be 100 to 150 years old in treatment strategies in terms of modern psychotherapy, and you would hope that the mental health field in this instance could do what most of us have done in our world, move a little bit further to solve problems. Certainly, medicine in general is problem solving, and we have a world with the internet, with iPhones, and all this great stuff.
So, Dr. London, if I may interrupt you again,
please do.
Yeah. So we're moving from GAD, generalized anxiety disorder, to literally dog anxiety disorder, and what you're describing is exposure therapy, and which worked extremely well. Yes?
Well, yes. There's no question. It's a behavior modification strategy. But you see, when you have, well about this, the DSM manual. Okay, the DSM manual, which is the Diagnostic and Statistic Manual of Psychiatry, and defines hundreds of different disorders. They separate one from the other. It's very rare to find a phobic person who's not full of anxiety in the clinical world. Right. Because they feed on each other. So this was a situation where both were operative. But when you're in the clinical world, the definitions are very helpful when you're filling out an insurance form or when you're writing a note excusing someone from work because they had a certain kind of an issue. But we won't even do that when you write a note for an excuse. But the reality is, there's so much mixing of our brain in terms of one thing overlapping another. Yeah.
The brain kind of gets mixed up, and I'm thinking about generalized anxiety disorder when a person is basically afraid of their shadow. They're afraid of everything. They worry about everything. How do you get a handle on that?
Once again, I think you use some kind of a rapid system in terms of how they got that way.
Okay.
Someone may say, well, everybody in my family was anxious about everything. And then you may have some kind of biological, even genetic loading for anxiety because it can be built into your brain chemistry and your neurons. Then someone could have learned it because they were stuck in a number of anxiety situations. Then someone could have been taught it, don't talk to strangers, don't go out at night.
Right.
Never trust someone else cooking your food. This stuff can go on, and they're the nicest people in the world who will give those messages to offsprings.
And we're becoming more and more a paranoid society.
Well, we sometimes there's a good reason to be paranoid, and sometimes we really worry about things, and then there's an exaggerated fear and sense of paranoia that can happen as well. You're right. You're absolutely right.
Gone are the days where kids can just go out and play unsupervised.
Well, absolutely. I recall that when I was 10 years old, 9 years old, I could go into a movie by myself. There was a matron. I can't say if you're old enough to remember that, but in movie theaters, there was usually a woman with a flashlight who walked up and down the aisles when the kids were in there. But you couldn't go to a movie by yourself, so you nailed it. Society has really, really changed, and with your children, you must. This is an aside here, but being overprotective is almost like being normal. Right.
I do hear you. So again, this person who is worried about everything, whether they learned it in their family, they're genetically loaded. Okay, how they got that way?
I think you've got to find one particular thing. Okay.
Yes.
I'm terrified of asking my boss for a raise.
Good.
This is very common amongst women.
Right.
Who I've talked to over the years who don't ask for raises. And one of the vignettes that I tell people is there was a woman who was just so anxiety-ridden about asking for a raise when all the men were getting raises in this organization. And finally she got up the nerve to ask for a raise, and the manager said, "I never thought you were going to ask. What are you waiting for?" That would really shocked her.
Right.
And that's another reality. You're waiting, nervous, and the people running the organization are waiting for you.
So when you say that someone has had a lot of anxiety-producing events in their life, and they're judging their future by their history, and you can encourage them to ask for a raise, and they get turned down, and they don't die, right? They don't die. Man proposes and God disposes. Negativity is there. You can't go through an active life and not hearing the word no. Right.
Yes works and no works. Sometimes maybe puts you in a bit of a bind. But we have to deal with no, and sometimes you'll get 9 no's. On the 10th time, you get a yes.
Yeah, and Dr. London, I teach assertiveness training in the corporate world when I'm not doing my clinical practice, and I tell people the same thing. It's wonderful to be assertive, but people come into assertiveness training thinking that all they have to do is be assertive, and they're going to just automatically get what they want. The other person has a right to say no as well.
Absolutely, and I think another important point is, and you probably know this only too well, is how you frame things. And some people, even in assertiveness, they come right out, and an assertion turns to aggression. And whereas there's so many ways to frame things, which is, by the way, Christmas is coming. By the way, summer vacations are coming. By the way, I've been meaning to ask you, by the way, how's your family these days? And when you hear that, you say, and just to get back to the topic, this is blah, blah, blah. There are so many ways to be assertive, but frame it in a very positive way without, going off the deep end, being angry.
A positive reframe. And in your step 1 learning phase, you ask, what exactly do you feel to the patient?
Well, what happens is, you're raising a question of these people who have pan anxiety. Everything's making them nervous and worry and fearful. But even with people like that, you can ask them, like I said before, what's operative now?
Right.
And if you can deal on one or two, and sometimes even three items, and you can put that to rest, there's an effect where it's contagious to other things. And once someone learns a strategy how to deal with number one anxiety or number two anxiety, oftentimes they don't need to deal with you at all in therapy for 3, 4, 5, 6, and 7, because you've given them a technique. And what is the technique? A new perspective on the old set of problems, you know. And you're probably very familiar with the mottos of cognitive behavior therapy: all or nothing.
Yes.
And a lot of people who are anxiety-ridden see the world in black and white. It's all this, or it's all that, or it's not this, or it's not that. I never have any friends. And then they tell you that yesterday they had lunch with their friend.
Right, exactly.
So someone sits with you and says, I just have no friends.
Yeah.
And, what did you do the last couple of days? Well, I was busy because one of my neighbors and I had lunch together. And we've been friends for about 10 years. And they say the word friends, okay? I just told you 14 seconds ago.
Yes.
They have no friends. And you point that out. And if this happens a number of times, a person can actually get a better handle and feel that they don't have a lot of friends. The reality is, if we look at all our lives, I shouldn't say all, but many of our lives, we don't have a lot of friends. We have some friends, and we have lots of acquaintances if we're in the work world in any form. So someone may not realize that there's hardly anyone around who can say, I have 100 friends. Politicians may talk to 1,000 people and say, my friends, but that's a different kind of lingo.
So basically, what is the story that you're telling yourself? Right? What is the story that you're telling yourself? Because it's all story anyway, and we might as well change the story.
That's another way of using language, which I would say you just said something that I've never heard of, and I'll use it.
Yes.
So we all have, as long as we're focused on getting someone better, we use our brains. And one of the things about the cognitive therapy and my learning philosophizing, and you just nailed it right now, you've got to use your brain. It's very active. And without throwing too many disparaging remarks, the traditional therapy was, tell me more, how do you feel about that? And it was not really getting into what you just said and what I'm trying to talk about. You've got to be really alert, and you've got to be in tune with the person you're working with. There's no such thing as one size fits all.
And Dr. London, I cannot believe this show has ended. And for everyone, you are so lucky, because Dr. London is coming back next week for part 2 of Find Freedom Fast, short-term therapy that works. This is Dr. Duffy Spencer wishing you great relationships.